Hello, and welcome to What is Innovation, the podcast that explores the reality of a word that is in danger of losing its meaning altogether. This podcast is produced by Outlast Consulting, LLC, a boutique consultancy that helps companies use innovation principles to solve their toughest business problems. I'm your host, Jared Simmons, and I'm so excited to have Maria Lucia Madariaga. Maria Lucia Madariaga, MD, is a general thoracic and lung transplant surgeon. She specializes in treating people with lung, airway, esophageal, and mediastinal conditions. Dr. Madariaga graduated from the Harvard-MIT program in Health Sciences and Technology at Harvard Medical School and completed her general surgery and cardiothoracic surgery training at the Massachusetts General Hospital, Boston, Mass. She also trained at the Mayo Clinic Thoracic Surgery and the Toronto General Hospital lung transplant programs. In addition to her clinical practice, Dr. Madariaga has extensive background in transplant immunology and large animal research. She is the principal investigator of the Organ Perfusion Laboratory and a founding member of the Complex Airway Center at the University of Chicago. May I call you Lucia?
Yes, you may.
Okay, Lucia, welcome to the show.
Thank you so much.
Thank you for joining us. It's quite a background you have and quite an amazing amount of work you're doing currently. A lot of interesting stuff there. Can't wait to talk to you.
Thank you.
Well, why don't we just start with what is innovation?
Well, to me, when you say the word innovation, I studied Latin a lot when I was growing up, and I think about the word nova or novus, and that means new. So innovation definitely means something new, whether it's a new solution to a problem, a new discovery, a new way to view some wrinkle in a patient's condition or something that comes up unexpectedly. So innovation is like making a leap. It's something new.
I like that. There's a lot of energy in that, making a leap. I like it. What isn't innovation?
I feel like innovation is a buzzword.
Mm-hmm.
And I don't think it needs to be a buzzword. I don't think it needs to be splashy. I don't think innovation necessarily needs to be on a worldwide scale.
Mm-hmm.
I think innovation can be one-to-one. And I view myself as more of a one-to-one person rather than a worldwide person. But I think you can make innovative leaps no matter where you are or what your environment is.
Well said. Well said. And when you think about one-to-one, tell me what that means.
Well, for me, in my job as a doctor, a healer, a surgeon, I really feel like the number one thing I need to care about is the patient. Mm-hmm. I feel it's very important to get to know the person, to understand their understanding of what's going on. Mm-hmm. And oftentimes I found that no one has really explained to them what's going on. No one has taken a piece of paper and drawn out what's going on inside their bodies. Wow. Or shown them their images. And especially in places like where I'm practicing now in the south side of Chicago, mm-hmm. I feel like people need more knowledge and people need teachers to teach them what's going on. So I find my role that I really like in clinics, especially as a teacher. I love mm-hmm. teaching my patients. So then we embark on this journey together where we decide based on the information we have, what's the best course forward. Particularly suiting for that patient.
Sure.
Sometimes I have to give good news, sometimes I have to give bad news, but then we make a plan and then we go through it together.
Interesting. I can imagine that no 2 days are the same in your line of work.
Yeah, that's true. I mean, we train so much to understand the standard steps of things. Like mm-hmm. This is the way to take a lung cancer out. This is the way to, perform an airway surgery. But every patient is different and every anatomy is different. So after you start opening up the body and cutting into things, you run into unexpected situations. And sometimes it requires some thinking on the spot. Mm-hmm. Sometimes you definitely need to rely on what you've learned from before and not necessarily have done. Mm-hmm. Sometimes you rely on things you've read or heard about or watched. So those are all things that kind of come together in one moment.
Right. If you think about sort of these leaps you're talking about, I can imagine there are giant leaps where you're maybe inventing a new process or approach or treatment or a new tool or drug or something like that. But I'm also intrigued by these smaller leaps that may happen on this one-to-one basis that you're talking about, or
Yeah.
potentially in the moment.
Right. Yeah. I definitely agree. I think, at least in my life, I've made many more smaller leaps, and I'm not sure I've made a big leap yet for mankind. But so I would say that if I really think about it, you can make a leap by, just opening a person's eyes to what's going on, by picking the right words, taking something to put it in their perspective, using simpler languages, looking at someone in the eye and really caring, or just sitting down and spending some time. I feel like there's a lot of things going on in patients' lives, and they come to you for help, and some of them are really scared because they've never had surgeries before, or cancer is scary.
Right.
And so I think there is a connection that you make, and there's different ways to make that connection, but I think it's important to make that connection, because then you'd establish a trust relationship, and then you can get through the disease together.
Right. And trust is a big part of a lot of the innovation work processes we talk about on the show. We've talked to folks in a lot of different industries, and the concept of trust or connection, relationship, those things come up in the context of how to really move innovation forward, or how to make change stick. And what struck me about what you were just describing is sort of the change management aspect of trust on an individual level, because what you're describing here, you build that trust in that environment with that patient. I can imagine that has a knock-on effect, in the community and with other people in terms of their ability to trust.
Yeah, and also what's a little bit tricky is that you need to establish this trust right away. You know what I mean? Like, so I'm coming in the room, I have a white coat on, I've never met this person before. I'm also probably younger than them because I'm still new at my job. And then I need to, with a couple of words, set them at ease, make sure they're not scared, convey information, establish a relationship that then, they'll trust me with cutting them open.
Right.
So they also have to trust me, like changing their lifestyle. For example, we really want patients to stop smoking before we do surgeries on them. And because that increases the rate of complications and prolonged hospital stay.
Is that a difficult thing?
Well, so that depends. I think, smoking dependency is very complex. It's like an addiction. And some people have been, doing that for a long time. But for example, when I do airway surgery is very tricky because so many things can go wrong. So I explained to them that, we need to make sure you're the best person you can be health-wise before you come into the operation. So we minimize all the risks that can happen. So I might need you to lose weight. I might need you to control what foods you eat so that your diabetic sugars are not out of control. I definitely need you to smoke. And so the patient needs to realize that for him or herself, that that's important. They need to do it.
You're almost enrolling them in the process as a participant,
Yeah.
There's so many parallels to influencing and getting things done in a business environment in terms of building that trust quickly, building rapport quickly, establishing a collaborative relationship. Because I think when I think of doctors and surgery, I do not think of it in the collaborative way you just described it.
Oh, yeah.
I think of it in terms of, okay, I'm going to go in here and they're going to operate on me, but just the entire way you view that process shows that even something that one-sided, seemingly one-sided, can be a collaborative thing.
And every patient is different. Some patients do want a more paternalistic, didactic, this is what you should do, sign on the line. But I tend to find that most patients are not like that. And, they might like a little less information. And I always ask them, do you want to see everything, all your blood, guts, and glory? Yeah, I'll show it to you. But I feel like it's better for us to be partners, go through things together. I find it more fun.
Yeah. I can imagine. I marvel at the kinds of the kinds of things you describe. I mean, when we talk about your bio and the things you the research you do and the life-saving surgeries you perform, it to me it seems like something that could be a difficult environment to operate in on a day-to-day basis and maintain the joy and the energy that you have.
That's true. And that's why people talk about physician burnout a lot, is because, there's a lot of stressors, personal life stressor, professional life stressors. What if something goes wrong in the patient? You know what I mean? And I think, different workplaces have realized that now and are trying to make programs for physicians so that they don't have this much burnout or risk for burnout, because we need to have a resilient well to care for someone else, because that's what we're doing, right? We're like putting ourselves out there. We're carrying them. We're carrying their cross at some point.
Yeah. No, that's amazing. That's great. And it feels to me like another space for innovation. How can doctors care for themselves, and how can other people help physicians and other medical professionals care for themselves in a way that is fit for the current environment?
That's right. I mean, I think one of the ways that we learn from other fields is, for example, when we learn about resting.
Mm-hmm.
I would say in the old school days, you don't sleep, you just work in the hospital all day long and all night long.
Right.
But we've learned from different industries the importance of sleeping. Shift work does not necessarily have to mean that it's suffering in quality. Like all different things that are slowly coming into the field of medicine.
Right. It's encouraging to think that the field of medicine can learn from the broader business world as well, and that some of the more old school ways of thinking that existed also in just for me growing up in the corporate world, there was you didn't want to be the first one to stand up from your desk and walk out. You stay till the boss leaves, and those kinds of old school ways of thinking, and the new things we've learned about human beings and how they work best and are most effective and efficient and focused. So it's good to hear that those things are being kind of incorporated in the medical field as well.
Yeah, it's really hard because, a lot of good doctors, they want to take care of their patients and they put their patients' needs above their own. And that's how we operate, because that's what we like to do, and that's how we care for our people. But we also have to sometimes take a step back and say, if you're not healthy yourself, then you can't help someone else.
Right. And be open to new and different ways of caring for yourself, even in in that environment.
Yes.
Yeah, that's so good to hear. I'm specifically curious about a particular part of your bio. It says you're the principal investigator of the Organ Perfusion Laboratory.
Yes.
Okay. All right. I don't want to put you on the spot, but I really do want to know what that means.
Well, so I would say, as part of a doctor and a surgeon, I think science is very important, because that's where you get the new discoveries and new treatments for patients. So it's very important to seek new knowledge. And as I was going through my training, there was always a research component to it. I would take, either a year out for fellowship research, et cetera, and exploring different fields. So, for example, transplant immunology was one of the fields that I was exploring.
Right.
And that was in my back pocket. And then as I went through training, as I spent some time at the University of Toronto and learned more about lung transplantation. And one of the emerging technologies that they use is that they put organs. So when you do a transplant, you need to transport an organ from the person who donated to the person who's receiving it. And it used to be you just put on a box of ice and then ship it on a bus to the next hospital.
Right.
But now they're putting those organs on pumps. So kind of keeping the organ.
Wow. So like a kidney or a heart is still doing
it's still beating. Yeah,
Yeah.
Exactly. So the heart on a pump is still beating. The lung on a pump is still breathing. So the idea is to keep it at its more normal state rather than just frozen on ice.
Right.
And so that was an idea I was exposed to. And combined with my transplant immunology background, I wanted to start a laboratory at University of Chicago where we could use both of those things and kind of combine expertise from all the other people who work there to make discoveries about organs on pumps and potentially make new treatments for those organs. For example, treating those organs before they go into people so that when they go into people eventually, they'll work better.
Wow. That is amazing. There's so many elements of that have so many different avenues on that my brain is just kind of pinging at the moment. But you created this laboratory. You founded it.
Well, me and a bunch of other people.
Right. Sorry, I didn't mean to put you on the spot. I know you're a very humble person. What I meant to say was you're part of the founding team.
Correct.
So this concept of that you just described is sort of almost like a hypothesis that you're in an extended proof of through this laboratory. Yes,
and I would say that I am by no means an expert in like most of the topics that we're dealing with.
Sure.
I just need to find the people who are experts and then make them all work together. Help them work together. So I'm very lucky that I'm surrounded by people who, have enthusiasm, have expertise, are willing to pitch in their time and then everyone has their own strengths in the group. And so hopefully we all mesh together so that we can achieve our goals.
Right. No, that's amazing. And that is another lesson I think that I'm taking away from this is just having domain expertise in a specific area is great, but what really unlocks truly, breakthrough, mind-blowing kind of innovation is being able to also be receptive to and collaborative with folks with different areas of expertise. I mean, putting a heart on a pump during transport is something that, in hindsight, makes sense. It's like, well, that's what it does. Let it keep doing what it does. And, it'll also tell us how efficient it is and we can help improve it once it gets there. All of those things make logical sense once you say it out loud.
Right. But you need someone to connect the dots.
Exactly. Connecting the dots is just, that's what innovation is all about. And that's what's exciting about the work you're doing and the work that gets done across America in every day. So many people bring different areas of expertise together and do incredible things. And this is one fantastic example. So how much time, Lucia, do you spend thinking about your training? And I'm going to explain that question. It's kind of a vague question. When you're doing what you do, you're a surgeon, I imagine a lot of it has been rehearsed and done over and over again, and there are specific procedures and checklists and things and all of that. How much of that is top of mind for you as you're working?
So it depends on what I'm doing. And it probably will depend on my stage of career too. So I'm early in my stage of career. I just finished my training. I'm gaining my independent wings. I have very supportive mentors and colleagues at work who I kind of like run by things when things are difficult. I would say because I want to be masterful at my job. I want to do the best I can for our patients. I rehearse for my operations.
Okay.
Like I prepare, I write, I envision things, I watch videos, I think about all the different steps. Some are more complicated operations than others. And so that's the proportion of time I spend with them. And then I write a checklist. And like for one of my operations is very complex, the airway ones. And at the beginning, I was quite nervous to do my first couple on my own. You know what I mean? Because I've always been with a senior partner or someone who was there if something goes wrong. And when you lose the airway, the patient dies.
Right.
So you have to be very careful, very planful to mitigate any risks. And so basically I rehearsed and rehearsed. I looked at all of my notes. And as I trained, I drew things. Like I made drawings of critical steps, or like in my mind, in my brain, I can see the picture of how things should look like. So then
Right.
it's not as if, it's not like, okay, do this, but it's more like, when you get it right, it will look like this. So I see the angle or something like that. And then so for this very complex operation, I would make a checklist and distill it down to 21 steps, I believe. And then I posted it on the wall. So my first 1, 2, or 3, I just had it there. I mean, I never looked at it the whole day.
It's a security blanket.
Exactly. Yeah. For 8 hours, I didn't look at it, but it was there.
Right.
You know what I mean?
Right.
So basically, before the operation, I write down all the steps and what could go wrong and what to watch out for. And then after the operation, I take a different color pen and I review. I'm like, okay, actually, I didn't do this as much as I wanted to. Actually, this didn't need to be done. Like give myself some feedback.
Right.
And then the final step is, so I have 2 senior partners who are very wise. And then I go to them for feedback. I'll be like, okay, what do you think I do?
Wow, that's fantastic. I love the security blanket of the steps that you probably never even glance over at, but it just gives you the confidence that to move forward. And the rehearsal step and the feedback steps, I think, are things that we all could benefit from, because you're extremely accomplished at what you do, and yet you still take the time to rehearse and re-rehearse, and you're very accomplished at what you do, and yet you still take the time to go give yourself feedback, review what you did, take the time to talk to other people and get feedback from them as well. I think a lot of times people associate the back end steps of feedback and peer review kind of things with failures or mistakes.
Yeah.
But I didn't hear you distinguish between those. You have a successful surgery, you probably still do the same review steps.
Oh, yeah. And I mean, I haven't done anything perfect.
Right.
like there's always room for improvement. There's always goals to strive for. And I always want to do that, because at the end of the line, it's a person there. I'm taking care of someone's family member, and I can't afford not to be good. So I need to be good.
Right.
And it's all this knowledge I learned. I should apply it. You know what I mean? It's like my ancestors, my teacher ancestors, come through me.
I love it. That's good energy. The rehearsal step is also super interesting to me, especially the language you use to describe it, around visualizing and not necessarily thinking through steps, but visualizing the outcome and what things should look like when you're done. Kind of seems like that leaves you the space, because that's what I was trying to figure out. I'm thinking, if you've trained, you probably got specific steps, but then earlier you mentioned that when you open someone up, everything's different, and you're going to have to improvise at some point.
Yeah.
And so maybe that's where you kind of leave yourself the space to improvise.
Right. And not only is the person different, but the people you're working with are different too. So surgery is usually a 2-person sport, like at minimum. Oh. It's me and my assistant, and our hands are dancing. So someone is retracting or pulling or exposing some way, so the other person can cut or burn or sew. Right. It's always give and take. And depending on the person across from me, the level of expertise, comfortableness, how they can see things, then you need to adjust for them too. Wow. So that's also different when you're starting out, because, when I was in training, the person across from me was already an expert. So I was just like, toot, toot, toot. There was like nothing to think about on that level of like who is surrounding me. But now I also have to think about my team members. Right. And you're right about that space. So now I feel like, when I do my rehearsals, I do definitely do a very thorough, maybe 1 or 2 run through where I just like every single step. And then as I get closer to the operation, maybe like when I'm in the shower or when I'm just about to go to sleep, I'll just think about the major steps, or just like, this is the tricky spot. Like this is, like just a little hump that I need to get over. Right. You do want to be loose, right. In the operation, I'm having fun. I'm dancing around. There's music. I want everyone to be happy. It's just like a happy thing for me.
Right. Because you're healing, you're helping people. That's amazing. That's a fantastic, fantastic insight into things people probably don't really think about very, very often every day. So thank you for that. Any advice? I mean, you've been given a lot of insights for us to think about. But is there any specific advice you'd have for innovators, people who want to take those leaps and be innovative like you?
Well, you know that I don't even think I'm an innovator.
Yeah, I know that. I added that just.
Well, I guess don't chase the word innovation. I believe in the power of hard work, and opportunities rise up if you are aware, you keep your eyes open, and to do something that feels right for you. You know what I mean? Something that brings you joy and happiness, and it's just like it's like nothing else. For me, for being a surgeon, it's so wonderful. It's fun, but it can also be sad, but it's also fulfilling, and that really makes a difference. And I would say that, you know, we talk about innovation in medicine, making new techniques, making new technology, new drugs, all that stuff, but they're done for a purpose, and the purpose is to heal someone, to take care of someone's disease process. And you have to make sure that they're right, you know, not just because something's new doesn't mean that it's good for someone.
Right.
So you have to make sure that it's good for the patient.
That's fantastic. That's perfect. Thank you, Doctor, for your time. I really appreciate it. And it's been a pleasure. We haven't spoken often, but I always enjoy it. And I'm looking forward to the next time we get a chance to speak.
Thank you so much. Bye.
All right. Take care. We'd love to hear your thoughts about this week's show. You can drop us a line on Twitter at Outlast LLC, OUTLAST LLC, or follow us on LinkedIn where we're Outlast Consulting. Until next time, keep innovating, whatever that means.